Guys, we got the laser turned on. When we utilize the deep tissue laser, we do require our patients to wear these polarized sunglasses, which helps to block any refractory photons, so any of the light particles that can bounce off the skin, which can actually damage the retina. So we always practice safety first here. Everybody else who's in the room, is generally shielded, but if you're far enough away, then you're okay. So we're gonna get started, all right? So all you're gonna feel is a little warmth,
okay?
Right? It's gonna start off kind of cold, but you'll see how the warmth ramps up, all right? So the laser initially just has a little red light right here, all right? It's not on just yet, so you can see that general light. It's very, very dim light on his hand right here, but we're gonna come around here, and if you wanna just watch, we're gonna pull this down just a little bit. And so the laser, we're gonna move it just nice and slowly up and down his neck. You can probably already feel just a little bit of the warmth.
Oh, yeah.
So when you've got a muscle sprain or a strain, or even a damaged joint deep in your neck, this will help to create or increase blood flow, as well as, like I said, your ATP. ATP is your body's energy molecule, and this helps to increase your body's production of ATP, or energy. So it creates quicker recovery time, reduced damage. We generally recommend, after laser therapy, following up with 8 to 12 ounces of water just to get a little hydrated after this, right? You'll see it'll start to get pretty warm. And really, damaged tissue, if you have damaged tissue, you'll probably feel like right over this right section of your neck, you have a little muscle that's popping out over here. You'll see that side will heat up a little quicker than this side, because this side, it looks like there's not a ton of muscle spasm. You have a little bit on that right side, so.
You can definitely tell the difference.
All right, guys. If you've ever dealt with any kind of carpal tunnel, one of the things that happens in the carpal tunnel is that your nerves and your arteries in your hand can get impinged, creating scar tissue, right? So the deep tissue laser therapy is going to help us to improve the blood flow down into the palmar side of the hand, and this will actually help to speed up the healing of any of the connective tissue deep in the wrist, and ultimately improving the blood flow of the arteries that go down into the hand and the wrist, right? Sometimes, even if you've ever worked out and you've ripped your hands, right? If you've ever had a callus rip open, we use the laser on people's calluses, which will help that skin to regrow a lot quicker. Another area we commonly use the laser on is the lateral epicondyle, which is the outside of the elbow, or the inner or medial epicondyle, where we get a lot of tennis elbow from backhanding, as well as golfer's elbow. So the medial epicondyle, or the medial epicondyle, and the lateral epicondyle, common areas where we end up with tendinitis, and the deep tissue laser therapy really helps to promote blood flow deep into the joint, into the muscles, and again helps speed up the regeneration or the regrowth of healthy muscle, connective tissue, and tendon and ligament tissue. Treatments last anywhere from 4 to 10 minutes, and we generally see patients anywhere from once a week up to 4 or 5 times a week. We see a lot of patients with broken wrists, broken hand bones, carpal bones, sometimes broken ankles, broken feet bones or foot bones, those tarsal bones down in the foot, and we see a significant reduction in the healing time of those broken bones. So one of the more common areas that we utilize the laser for is plantar fasciitis. We have patients that come in that have been dealing with plantar fasciitis for years, 2 years, 3 years. The blows my mind that people would limp around for that long without actually addressing the cause of the problem, which is generally something going on up the back of the leg. The laser helps us to get blood flow deep into the fat pad of the heel, as well as the plantar fascia tendon and musculature down here in the bottom of the foot. The other area that's commonly affected is the Achilles tendon, right? So if you're a runner or a biker or anybody who's active and you've developed an overuse injury like Achilles tendonitis or posterior tibial tendonitis, that's a big word, but a lot of people have issues with the back of the calf here. And this laser, in addition to some of the other modalities that we use like Graston technique, deep tissue work, as well as fascial adhesion breakup, or what we call instrument-assisted tissue release, this helps us to speed up your healing time, improve recovery, as well as get you back out on the playing field faster.